Channel Africa.
Severe flooding in Mozambique has created one of the country's most challenging humanitarian emergencies in recent years, affecting more than 500,000 people, including hundreds of thousands of children. Entire communities have lost homes, schools and health facilities, whilst displacement and the risk of disease are rising fast. In response, UNICEF and the European Union's humanitarian aid arm, ECHO, have teamed up to deliver life-saving supplies via specialized airlift, including medical kits, tents for temporary clinics, clean water equipment, child-friendly spaces, and education and protection materials. Now, the international support comes as the rainy and cyclone season heightens the threat to vulnerable families. To explain a little bit about what's going on and UNICEF's response on the ground and how its partnership is helping protect children is Guy Taylor, who's UNICEF's Mozambique Chief Advocacy, Communication and Partnerships. Thank you very much indeed for joining us, Guy. Good to talk to you again.
Thank you. Good to speak to you too and to your listeners.
So, Guy, give us a sense of the scale of what you're seeing and how families and children in particular are being affected.
The scale is immense. The numbers keep going up day after day. Yesterday, new estimates suggested that almost 700,000 people have now likely been impacted by this historic flooding event. Around 220,000 children cut off from school. About 100,000 people forced to flee their homes. I mean, those are all big numbers, but I think when you're on the ground, as I was a couple of days ago in Shai, and you speak to people, it really drives home the impact, the personal impact that this is having on everyday people. You know, parents who really don't know where they're going to get the next meal for their children, people without access to clean water, children who've had to stop going to school. A very real risk of them dropping out from school. So it's a very serious concern. We have the obviously immediate impact, the lives that have been lost, the homes that have been destroyed, the belongings that have had to be left behind. But then we also have the medium and the longer term impact. Immense amounts of standing water covering almost all of, or very large parts of the province of Gaza and other provinces in southern Mozambique, which create a major risk for waterborne diseases, cholera, malaria, typhoid, diarrhea, all big killers of children. We have the children cut off from school, as I mentioned before. We have people who are unable to access treatment for example, malnutrition, severe acute malnutrition, already a very important issue in Mozambique even before this flooding, and often deadly to children, particularly when they're not able to access healthcare. So it's a very worrying situation. We're working to respond, but I think the humanitarian response here is very much overstretched with the scale of this emergency.
I suppose then it's no exaggeration to say that the work that you're doing, UNICEF and the EU and this airlift is nothing short of life-saving for many people there. How challenging though is logistics in terms of reaching everybody?
It certainly is. We're very grateful to the European Union, ECHO, and the other partners who have really stepped up and supported at this time. We had on Monday morning, as you mentioned, a Boeing 747 jumbo jet chock full of supplies arrive in Maputo thanks to the support of the European Union, which is now being distributed to the people most severely impacted. Access is an important, major challenge. As I flew over Gaza the other day, it was like flying over the sea, with the occasional island of residences and homes popping up in the middle of huge expanses of water. Reaching those people is very challenging. We are working with, in support of government and with humanitarian partners to find ways to reach some of those most isolated communities. There are search and rescue efforts underway, and we're working to use things like boats, helicopters to reach the hardest to reach. The government is putting on special shipment services to bring large quantities of supplies from Maputo to Gaza since the roads have been cut off. There is a train service which is being put on specially to bring supplies up there. So every angle is being explored to make sure that we can really get these supplies out there quickly to the people who need them the most.
The children, sharply on your radar, tell us about their experience. I guess it's more than just missing out on school. There's psychological trauma involved with things like this.
Absolutely. I mean, children I was speaking to in Shai had to literally flee their homes without any real advance warning, and just have to leave behind everything they own. Families have lost their crops, the animals that they rely on for food, and of course their shelter. They've lost their communities, often having to move into temporary resettlement sites, often in very crowded conditions, which themselves can lead to the spread of disease, put children at risk of protection risks. So we are on the ground. We're working to provide supplies, services, safe places to be for these children and families and communities. But the humanitarian response, as I say, is very much overstretched. Even before this crisis, organizations like UNICEF were facing serious funding shortages for our humanitarian response in a country where many millions of people are in need of humanitarian support. So additional support is really urgently needed here.
Can ordinary people, businesses, and people who want to help assist you in any way?
Absolutely. Many businesses, many individuals are already providing services, providing supplies, donating money, all of which is very badly needed, and all of which is spent directly on reaching those children. So we're really mounting a major humanitarian effort here, again, together with our partners, many humanitarian partners, all working on their areas of expertise to deliver, as I said, supplies, services to those most affected, to try to ensure their safety, their well-being, and to try to get those critical basic services back online as quickly as possible.
Guy, that's where we're going to have to leave it. Thank you so much indeed, not just for speaking to us, but the work that you and your team are doing on the ground in Mozambique and in the region generally. So thanks so much indeed.
Thank you.
It was Guy Taylor, who's UNICEF Mozambique's Chief of Advocacy, Communication and Partnerships, giving us a sense of the scale of the destruction and displacement that the Mozambican population is experiencing right now. 650,000 people, we believe, are displaced, and as he's saying, he was flying over parts of Mozambique, an area called Gaza, and it looked like a sea. That's how flooded the land was. But UNICEF is working hard with help from organizations such as the European Union to reach some very needy areas, but logistics continue to be a problem. If you can assist, please open your hearts and assist, because the children in particular need for us to pay attention and to help in any way that we can. It's 7:30. It's time for your news headlines with Onelin Sinsi.